Welcome back to Minding My Mental Health. I am Tenetria Williams, licensed professional counselor and mindset coach. You guys know what I want you to do. I want you to hashtag live. If you are watching us live, you'll know you're watching us live because it will have the word live in a red box at the top. Hashtag live and let us know where you're watching from. And if you are watching the replay, hashtag replay. And again, let us know where you're watching from. Share this video, tag some friends. We want to get people out there. You guys know what we want to do here at Minding My Mental Health. Our job or our focus here is to tear down the stigma of receiving mental health treatment, taking care of our mental health, and to bring awareness into our community about our mental health. Join me as I welcome Dr. Alicia Trent Williams. Dr. Williams is an amazing physician in Northwest Arkansas. She's going to share more about her journey, about things that's going to help us today. But again, you guys give her a shout out, say hello to her. If she's your doctor, give her a shout out. Let us know what a great job she's doing. So Dr. Williams, thank you so very much for joining us today. We, again, as I said earlier, we just really want to tear down the stigma. Many times what happens is people assume that mental health is only about dealing with illness and dealing with the struggle. And the goal of this program or this broadcast is to show that we all, no matter what our profession is, no matter our educational level, our situation, we all have to take care of our mental health. And that's nothing to be ashamed of. And in fact, that's encouraged. And so I want to bring people again from different life situations, different professions, so that we can get into this and really do some good work. Okay. So Dr. Trent, tell us about your journey to becoming a physician.
Yes. So I would say I probably had a more non-traditional journey to becoming a physician. I am a family medicine OB physician, or FMOB. So that means I do general family medicine and women's health in my practice. But I didn't take the traditional route. I was a music major in college. But I knew that I wanted to go into medicine. So I still got all the prerequisites and, of course, all the classes that I had to take for the MCAT, but I wasn't the typical like pre-med or biology major. So like everyone, you can still do something you're passionate about. And, still, if that's a goal of yours, achieve that goal. I also had children pretty young. And so both of my sons were born while I was in college. So I entered med school already being a mom. And by then I was divorced, and so I was a single mom. And of course, that also was just not the traditional. And so I didn't have the same study routine or, just day-to-day routine for classes like all of my classmates. But still, nevertheless, I still persevered. I went to med school in Little Rock at the University of Arkansas. And then I wanted to get out of Arkansas. So for residency, I only applied to residencies outside of Arkansas. And so I wound up in Michigan for residency. And I will say that that was not my first challenge. Definitely in med school, I faced challenges. Like I said, just having a family, but also just the day-to-day challenges that everyone else faces, racial challenges and things like that. So I definitely experienced that in not only med school, but in residency as well, which of course brought on their own stresses. But I came through that, finished residency, but I knew that I wanted to do the obstetrics or the OB women's health component. So then from residency, I entered an additional year of training in Memphis, and that's where I trained in high-risk obstetrics and got that surgical training and just management training of those high-risk obstetrical patients. And that's also where I met my husband in Memphis and had my third son. And so now it's really, I was already a mom, but now I also had a baby in fellowship time. So again, just more, so just more, more suitcases, I guess, that I was carrying with me as during my training time. But I was able to manage the time commitment and the stress component of being a mom, but also the hours and time commitment that it takes, in training. And from there, that's when I arrived in Northwest Arkansas. So we've been here going on 8 years. After I finished my fellowship training, I came here to work, and I've been here ever since. I was first an employed physician, but now in the last year, I've started my own medical practice. So I've kind of seen everything from academic medicine to private practice, employed medicine. So I've seen it all. And again, they all come with their own challenges and things that you have to navigate through and get through. So I've kind of seen it all, but I think that also is what helps me to be able to relate to a bigger population of people because I have such a traditional route. And so I think that helps make me a little more relatable to others.
So now I'm listening, and I know I am a mom. I've been a single mom. I'm now a married mom, and all of those different things. That in itself, doing that while going through residency, like that just sounds super stressful. What was your system to manage stress, and how did you take care of your mental health through all of those, things that really require so much attention?
Yes. So during that time, number one, I have a very, very, very supportive family, very supportive mom, who can just, she's that type that she's in tune enough with her children that she can, over the phone, if she hears that, our voice sounds different, then she's like, what can I do? How can I help? My sister moved with me to Michigan my first 2 years of residency and lived with me. And that really helped, of course, a ton. To
Sure.
Some pressures and stress. And so I just had that other listening ear, sounding board, and she definitely helped with my boys. And I worked out a lot. Actually, residency is when I started running, and I was doing half marathons, and
Wow.
really running really became a big stress reliever for me. And so I would get up early mornings, or I would run immediately when clinic was done. I wouldn't even leave clinic. I would just, after my last patient, I would immediately change clothes and I would work out, and then I would go home because I knew, once I'm home, that's it. And so I would get all of that done before I even entered the door. And it became enough of a habit that I started running races, and I would do probably a race a month. But really, running is what helps me, while you're out on the road by yourself, listening to music. I was able to really decompress anything that had happened that day. So definitely exercise was a major, or has been a major stress reliever for me. So
okay, so I'm already hearing nuggets, and I hope everybody who's watching is hearing. The first thing I heard, or that jumped out to me, was I took my sister with me, so you understood that this is a task and I'm going to need help. And I think so many times people try very hard to just I can do it, especially the old strong Black woman. I put the weight of the world on my back type of thing. And I love the fact that you said, yeah, this is going to be a lot. Let me get somebody. And thankfully you had a supportive sister, supportive family that could help you. And so I encourage people, utilize your support system when you're going after your dreams. Utilize your support system when life is just coming at you, even if it's not about going after a dream. Utilize that help, because it is a part of taking care of ourselves. The next thing you talked about was the working out.
Yes.
Working out. I tell people all the time, working out is such a great, powerful, non-medication, no negative side effects coping skill, right? And so it is really, and I'm not against people using medication, but so many people just want to just give me something, and that doesn't always fix it. And so I think exercise is really underutilized when we're talking about taking care of our mental health. So I love that. I hope people are catching the nuggets that she's dropping. You talked about facing some racism or some racial issues throughout, I think you said residency, and maybe even as a physician. Can you talk to us about some of those battles or situations that you faced?
Yes, absolutely. So one that sticks out to me, because I think it was just a pivoting point in my residency, a one of the clerkships. So basically anyone that we rotated with, any physician that we like went with for, usually it was like a month, they were called they were clerkship. And one of the clerkship physicians, she went out of her way, like literally the clerkship, the rotation had just started. And so basically at the end of each rotation, those physician teachers, they get to, you know, of course, that they evaluate us, like that's how we get our grade of sorts. And she went out of her way to give me a bad review, and it had just started. And she basically, probably looking back, what she did was illegal, but she went to another, in the ACGME, she went into another clerkship person, and as if she was that director, and wrote their review. And what it all was based on was my appearance. And so, and you know, as a Black woman, we all wear our hair different all the time. And I'm definitely like changing my hair all the time. And I honestly don't remember, but at that time I was wearing my hair natural. And so I don't know if I was like in between a style or changing it, whatever. But I was wearing my natural hair. And otherwise, I was dressed like I normally dress. And I'm pretty known for fashion or whatever. And so I was dressed well, I would say. And I was wearing not a mini skirt, you know, I was wearing just a knee-length dress and heels and my natural hair. And I had little like earrings in. And ironically, the outfit that I had worn to her section, I had worn previously to my home family medicine clinic that we had to do so many shifts per weekend. So my family medicine faculty had seen me in this outfit. But anyway, she wrote a review saying that I came dressed like a video girl, and I had big gold hoop earrings on and big poofy hair and a mini skirt and stiletto heels, and I was just not appropriately dressed for the clinic. Also, ironically, that morning when I first came into her clinic, the other residents that were present were like, "Oh my gosh, you look so great. You know, we just roll out of bed and throw on scrubs. How do you have time to get dressed in the morning?" And, you know, just making small talk. And so then we finished for the day and I left. And, you know, throughout the time, she would drop little comments like, you know, if there's a code, how are you going to get there in those shoes? And, you know, just like different comments about how I was looking. And I said, well, you know, I would get, you know, I was answering her questions. I didn't know. So then at the end, maybe by the end of the week, my residency director had called me in the office and told me what was said and asked what I wore. And actually, like, I had taken a picture of like exactly what I had that day. And then I took him the picture and was like, how does this look? Because basically he told me I was put on a performance improvement plan for my attire.
Oh my God.
It wasn't a standard for this kind of complaint. And so they really didn't know how to punish me. So they put me on a performance improvement plan. So then my contract, of course, for my senior year was at jeopardy and all these things. Oh my God. And then he told me, you know, if my residency was in Ann Arbor, Michigan. So then he let me know, you know, if the residency was rotating in Detroit, probably there would be no issue with how I looked. But since it's not in Detroit and it's in Ann Arbor, that's probably, you know, what raised an eyebrow. And I was like, we have residents in with like muddy sneakers on. Like, so anyway, I purposely wore the exact same thing to clinic one day. And then when things were done, I was like, you know, is this appropriate? Am I appropriately dressed? And he's like, oh, yeah, you look fine. I was like, okay, because this is exactly what I had on the day that I got this scathing review. And you chose not to listen to me, but to take word for it. Because literally for the next 6 months, I was having to write, you know, report. I was made to come up with a dress code because they realized that there was no dress code. So technically I hadn't violated dress code because one didn't exist for the hospital. So as part of my performance improvement. It was to write a dress code and all of these like nonsense things just to give me something to do. And you know, I had an advisor at the time, and she just kind of like counseled me like, just do it, just get through, you're almost done, etc. And that's what I did. And you know, looking back again, probably the treatment, especially like the comments of, you know, if I were in Detroit, because literally she wrote video that I came like, what is a video girl? So it's just the connotation that, you know, here's this girl and she's coming in here with her natural hair out and unkept and whatever it is that they wanted to label me. So yeah, it was definitely stressful because, you know, you try to think in your mind like, well, what did I do? You know, and self-evaluate. What can I do better, since I didn't even think that I did, you know, there in my mind, not purposely doing anything. And so that was definitely stressful. And, you know, again, thankfully I have people, you know, whenever I'm faced with things like that, I try to not internalize it, but to get it out and talk with someone, whether that was my mom or my sister, and just get it out and talk about my feelings, talk about if I'm faced with something like this again, how would I maneuver through it, and just kind of work through those things outwardly instead of all in myself. Because definitely if you keep it in, it's going to be that much worse, and you're only like hearing your voice. And when you speak out loud, then you're getting feedback from others. And so that's kind of how I try to approach any situation that I really feel is stressful and can eat at me. So.
Yeah. So what I heard was you came in with all of your Black girl flyness.
Yes.
And it was a bit much for this particular person, because it doesn't even sound like it was a bit much for everybody. It was this one person who had a problem, who caused a fuss. So way to stay fly, way to continue to get through that in a professional manner. All of that. Now I want to know, because you are a Black woman, you have different experiences, different knowledge, even how able to bring that experience, I guess, to your treatment. You know, because sometimes there are things that people that may not understand about, you know, African American client or patients. You know, how have you been able to bring that into your practice or into your work?
Yeah. So number one, I try to, any person that I'm dealing with, whether they are, you know, a minority of any kind, because I seem to, you know, once I came into Northwest Arkansas, I attracted minorities of all kind, Hispanic, Marshallese, just anyone brown. They saw another brown person in town. And so I try to let them know, you know, I have been that single mom, young single mom in a doctor's office and felt not listened to. So number one, I try to approach every patient with, I'm just here to listen. Because when you listen well enough, then a patient will tell you their story. They will tell you really, usually a lot of times for me, exactly what's wrong with them. And even if they don't know terms, you know, even if they're terrible at describing symptoms they're feeling, if you really just kind of listen to their story and piece things together. So that's what I tell people. I've been there and not listened to. And so I try to, number one, just bring that and the listening. And then I also will tell people, like, you know, statistics. Like, I know that you as a Black woman pregnant, your risk of injury or sickness in your pregnancy is way higher than someone that's not brown. And so because of that, you know, I may have you doing something extra, or I may, you know, like doing an extra lab or doing an extra ultrasound. It's not because I'm trying to run up your bill. It's because I want to make sure that you and baby are doing just that much okay. And so I try to explain to people rationale, but also I also try my best to let patients get in on their treatment plan. Because when I tell people at the end of the day, you have to go home and take this medicine. That's what, you know, mental health things, or, you know, whether it's mental health or blood pressure, you have to go home and take this medicine. So if you don't understand what it's for, or if you don't agree with it, then neither of us are going to get to the goal that we want. I try to, get their goals and, what do they see their treatment looking like and what do I see and how can we get both of those and meet in the middle. Sometimes we can't, or sometimes it's a compromise of, okay, well, we can get to your goal of no medicine if we do my goal of medicine right now, but also let's do some other things like a counseling or something like that. And, I'll let people know, especially mental health. Statistics and data tell me that 6 months, so if your disease is more severe enough that you need medicine, we can always reevaluate that at 6 months and see if your situation and circumstances have changed. Maybe we can de-escalate. If you're in counseling and you're doing all these other things to help your mental health, this doesn't mean that you have to be on this medicine for the rest of your life. So that's kind of one way that I try to approach patients and let them know that I'm listening to them and I want to help them with whatever their issue is, but I also want them on board with the treatment plan and it being, some of their idea as well.
So it sounds like you are very much empowering to your clients. What would you say to people listening or watching this that has a physician who is not so open to hearing what the patients say? Because a lot of times, you have to encourage people, you have to advocate for yourself because unfortunately, sometimes doctors don't listen. Like you said, you've been in that position where they're not listening. How would you tell people, or what are some things that you would tell people to do when they're trying to advocate for themselves with their medical or mental health?
Yes, definitely. Then you hit the nail on the head. Like definitely advocating. If you feel like, hey, confront the situation. I definitely don't suggest shying away from it. If you're talking and you feel like that provider's not listening, then say, I really don't think that you heard what I'm saying. Maybe I can say it in a different way. If they're still not receiving what you're saying, you can always ask for a patient advocate. If you're going to a not private practice, so a hospital-based system, they have people on staff that are medical advocates for you. And so you just ask whether you're in the ER or you're admitted in the hospital or you're in the clinic. You can always ask for the patient advocate to be involved in this situation and in this case. And basically then that person takes a look at your file, looks at what's going on. They talk to you, they talk to the provider, and they try to mediate the situation, basically. So that's always an option for you. And again, if you're in the hospital, like in the ER, that person can come right in the ER, which is where a lot of times people feel just kind of like rushed through their situation. So yes, definitely I always recommend people to do that. I always recommend people to bring someone with them to the doctor, ER, hospital. You have another set of ears. When you're sick or if you have something going on, a lot of times it's hard for you to stop and ask those questions, or the provider may be going through and kind of rushing through and telling you, things. And then at the end, you're like, I don't even know what I'm doing. But if you have another set of ears there, that really, really helps. And they don't have to be a medical person at all, but just knowing that you have someone there that, they're not experiencing the same illness or sickness or whatever that you are feeling, they're much more apt to ask those questions or stop the provider. Another thing I always tell people is if you don't understand, just tell the provider or tell your physician, hey, can you please say this in a different way? I didn't quite understand that. Especially, lots of people that English isn't their first language. Sometimes they're embarrassed to say, I don't understand. Don't be embarrassed. Stop them. If you don't get it, just say, wait, can you say that in a different way? I didn't quite understand. And if they're not able to, again, you always, always, always can ask for another provider, another nurse, whatever the case is. You can always ask for backup for that. And at the end of the day, if you didn't get that and you aren't happy with your visit, you don't feel like you got it done, you can always complain to your insurance. And your insurance will do all those things I just said on your behalf. The insurance will they will stop the payments, they will ask for the advocate on your behalf, et cetera, et cetera. So you always can dispute a charge or a bill that you got from a provider, and then you cite the reason as to why you're disputing the charge, and then the insurance will investigate that.
Oh,
So
that is good information. I didn't even know that stuff. So
yeah.
I'm really glad you shared that. Go ahead and drop a 1 in the comments if you already knew about the patient advocate. Drop a 2 if that's new information. And I definitely didn't know about the insurance piece, because when insurance starts saying they're not paying, people start listening.
Right.
So I think
Exactly.
that's really a powerful
Yeah.
tool for people to be aware of. I want to know, you said you work with the OB side and family practice. What are some of the common mental health issues that you see with your patients? What are some of those common things that you see come through?
So one, for pregnant women, or especially, I will see maybe some people that had depression or anxiety or something like that in the past, and then it coming back or creeping back in the pregnancy. But then they're pregnant, and so they're fearful of
Right.
doing any medicine or doing
Yeah.
any. So I see that a lot. And that's a challenging one, because then we again have to make shared decision making. And then, because sometimes people's mental health problem isn't severe enough to meet criteria for medicine. And you're right, not every case needs medicine, and there are screening tests so we can see how severe is your depression or anxiety, etc. And they're markers that, hey, research tells me you would do really well with counseling only. I see challenges with that. A lot of times people don't want to talk with a counselor. So like, oh, I can't open up to someone. And so I try to really, there's always, not always, there's a lot of times a bad connotation to a counselor or therapist. And so I try to explain to people what a counselor and a therapist actually does, because, the presentation is the TV. And I try to explain, not like TV. You're not just like plopped on the couch and they're like, spill your guts to me. It just doesn't work that way. And honestly, every patient, I tell them, everybody needs a counselor. Everybody needs a therapist that they have on their Rolodex, that if times of trouble come in, that they need to call. And so it's not, I try to take away the stigma of counseling, because it's just so needed and it helps so much.
Thank you so much for doing that. And I think, as a professional counselor, I'm also telling people there's a connection between our mental health and our physical health. If you are not drinking enough water, if you are not exercising, if you are, having other physical issues, those symptoms can show up as mental health issues.
Right.
And sometimes some of those mental health issues can show up or manifest through physical health issues. I don't know how many times I've gotten referrals from doctors because someone came in thinking they were having a heart attack and they were having an anxiety attack, or someone thinking, I remember one person was saying, I thought I was going blind, and it was, again, a panic attack. And so it's not we're against each other. We work hopefully work together in tandem so that we can, improve the overall health of the individual. Because if we have strong mental health, that means we're talking about our sleeping, our eating, our physical activity, all of that. But also we're talking about how are you processing? Something else I see a lot with postpartum, whether that's depression, a lot of even postpartum anxiety, and people don't talk about postpartum anxiety often. They just go, I didn't know that was a thing. That's a thing, postpartum anxiety. And so what I'll tell people is they'll come in and I go, now, when'd you have your baby? How long has this been going on? Okay, you need to go back and talk to your doctor, because for whatever reason, it sounds like there's a connection. Talk to them. And sometimes I'm like, your this hormone may be low, this something, and I don't know all the medical jargon, but I know enough to say, talk to somebody who knows more than me when it comes to that. And I'm always amazed and really happy when clients go, I talked to him, we got some medicine, or we got a system that now I'm, kind of balanced, I guess.
Yes.
Now, go ahead.
I was going to say, and what helps me also is, since I am family medicine, I see the babies and the moms. So a lot of times I'll see, them together, but sometimes I'll pick up on, just like during the baby exam, a mom and her mood either down or really, really anxious. And, okay, well, let's address that. I know you're here for baby,
Yeah.
but, like, let's address you too. Like, what's going on? Because postpartum, a lot of times that's what ends up happening. Moms are so fixated on the baby, and they take the baby to all their appointments,
Hmm.
and they're like, did I have my 6-week checkup? And it just kind of
Exactly.
by. But for me, since I do get to see the babies as well, sometimes that's when I'll pick up on a mom
Mm.
who's not doing so well, or not sleeping, or things like that. So. Mhm.
So I want to encourage everyone, if you're here, if you just had a baby recently, or heck, anything, if something feels off, go ahead and say, I need to get checked out.
Yeah.
We talked a little bit about what you're seeing in the practice. What about amongst colleagues, people with, like, heck, I'm a counselor and I have clients who are physicians and all of these things. So I know physicians have their own stuff as well, right?
Yes,
What are some
physicians are
common
like
things that
one of the
physicians are
highest suicide rates in professionals
facing?
are. And so, yeah, it's definitely a big deal. And the thing with physicians is, they mask it. They hide it with, I'm working extra and things like that. So it's really important to tap into your colleagues. One thing I try to pick up on, again, just like appearances, like if someone is looking, like they never get dressed, they don't look like
Mhm.
they're, like shaving anymore, or, things like that. Just like, hey, is everything okay? Just kind of pulling them aside.
Yeah.
With physicians is your license, right? So like we all have to do these questionnaires every year um, to continue getting your license renewed, about substances, about mental health.
Mhm.
And so many people are afraid to check yes, and that they're struggling because they don't want to say they're having depression, because they don't
Right.
want their license to be in trouble. So it's a big deal in physicians. Thankfully, I haven't personally had any colleague to commit suicide, or anything to that severity. But I do have friends that have
Mhm.
had other fellow colleagues to commit suicide or attempt suicide, different things.
Mhm.
It is definitely a big deal that physicians are definitely at higher risk for more severe disease, I think.
Yeah. What do you think is the reason behind that? I have some theories, but tell me from your perspective, what do you think is the reason for those high rates?
Well, as we started this, and I was giving my rundown on the path to become a doctor.
Mhm.
And so number one, you go through so much training, and none of that is paid. It's all
Mm.
not paid.
Yeah.
And so you've accrued a large amount of debt, and then you work for during your training, and you're not getting paid. And so
Mhm.
you're delayed with the normal things. Most physicians, unless it so many physicians don't buy, just basic things of buying your first house, buying your first
Mhm.
car, so they're well into their 30s. And there's just the stigma of, well, you're a doctor, so you make a lot of money. And
Right.
so for some people, they live that lifestyle like, I do make a lot of money.
Ah.
And you also carry a lot of debt and a lot of weight. And most people, when they do get out of training, you are a higher earner, but definitely it's not with inflation, et cetera. I mean,
Mhm.
physicians are not immune. Um, your take home pay is not probably what you thought it was going to be when you were a kid and said, I want to be a doctor. And so it just comes with a lot of baggage. And so a lot of physicians just work themselves to the ground, to the bone,
Mhm.
trying to support a lifestyle and a debt that they've accrued. And that becomes overwhelming. And many physicians are, of course, type A personalities, and
Mhm.
trying to have control. And there's not one business class in med school. So you don't take any business class in med school.
Ah.
You don't learn anything about managing money or debt or, whatever. And so
Yeah.
a lot of physicians come out and they have that heavy burden of debt, and it just becomes a lot. And that is a major, major, major culprit to a lot of
Yeah.
physician depression. Then there's burnout. So a lot of doctors will just get tired
Yeah.
of working for someone, and then they also feel overwhelmed of the thought of starting their own practice.
Hmm.
And so it coupled with, I have all these debts. Now I have this house and the cars and a
Right.
wife or kids in college. One of my old colleagues at my former location, he said like he would have retired a long time ago, but now he has two daughters in college, so he'll be
Mm.
working until they get out of college, and just different things like that.
Yeah.
And you become the breadwinner, you become the, everyone's dependent upon you. And so I just think a bunch of those kind of like just stresses, and like you said,
Hmm.
not knowing how to manage it very well, it just becomes overbearing.
Yeah. Now you brought up something about being the breadwinner, and a lot
Mhm.
of people kind of depending on that. Talk
Mhm.
about that, how that can be, you know,
Yeah.
and not to make everything about race, but I know particularly in the African American community, when you have someone who does get a job that's a
Mhm.
high earning job, people start going, "Oh,
Yeah.
I can ask cousin Alicia. I can I can call, or even just your immediate family, your husband, your children. It's still this idea of, well, you make this much money. We should be
Mhm.
able to do those things. How do you, or
Yeah.
how do you see colleagues balance out that? How do you establish boundaries with
Yeah.
your time and your money in that sense?
That is a tough one, I will say. So for me, family wise, I will say my mom, she is the defensive end on that. Like she, if she hears like any family, like she'll say no. Alicia has her own
Mhm.
responsibilities. Because
So mom is standing there as a guard
yes.
dog. Okay.
Because I think in my family, a lot of times people will just come to my mom and ask her to help them because they assume that I'm like supporting her lifestyle, even though my mom
Mm,
still works full time. But they assume that she is
mhm.
supported by me. So then all of her work money is free. And so
Oh.
that's kind of really the dynamics in like extended family. So she really like deflects a lot of that. Like, no, Alicia's not supporting
Mhm.
me. Alicia has her own family. Um, but yeah, you're right. Like, again, like I said, I went to college with my two sons and I was a single mom. So they saw me, like struggling, no money, getting food boxes, been the whole gamut. And so once I became a doctor, they were used to us like getting to eat out once a week for dinner, and
Mm.
that was our treat. And or choosing like, okay, we're gonna eat out this Friday, or we're going to the movie instead, and like having a one treat thing, and that was a big deal. So that's how they kind of came up. And so it wasn't too much, I didn't have to do too much many boundaries with them because they, that's kind of what they were used
Right.
to anyway. And they've known me longer not being a doctor than being a doctor. And so it's really the younger one. And so we try to, because he was born into mom being a doctor, and he's been flying on airplanes for vacation since he was one. And so his lifestyle is different than everyone in the entire family. So it's really grounding him. And so, I mean, honestly, actually, we talk a lot about, um, homelessness and different things like that. He's
Mhm.
he's seen it. I take him to volunteer and things like that. So I mean, he still asks me for Robux randomly. Like, of course, you can just give me Robux. Like, that's not a
Of
big
course.
deal. But and he's 7. So, but it's I would say probably the biggest challenge will definitely be him and keeping him grounded, versus like the other ones. They kind of have seen both sides. So
Gotcha. It sounds like you're doing a good job, and mom is standing as defensive uh
yeah, that's
in
definitely
the
a big
middle
help.
there.
So I appreciate her. Thanks, mom.
Yeah, shout out to all the good mamas who say you're not gonna take all my baby's money.
Right.
So one of the things that you talked about was, that piece of the finances and the debt, working a lot. How does that, just the scheduling, impact your mental health and your and your relationships and your social life and all of that?
Yeah. Honestly, for me, I mean, social life was for a long time. It's definitely getting better now. But for a long time, again, I was on that roller coaster too. Also, a couple things for me. So, one way that doctors are paid are by what we call RVU, so your productivity. So, if I have a pregnant woman and I've seen her entire pregnancy, but I take a vacation and I don't deliver her baby and she goes into labor while I'm gone, then whoever delivered her, they are paid for her. So it's like, because for pregnancy, you don't get paid until the baby is out and the 6-week visit.
Wow, I did not know that.
Yes, so pregnancies are paid like in a global package. And so you don't get a dime until the baby's out. You do a 6-week visit. And if they don't come for the 6-week visit, then 6 weeks has passed. Then that's when you are paid for all of that time. So for me, it wasn't even financial. For me, I've built these relationships. I have seen you for 10 months and been in all of your visits. I don't want to miss a delivery. And so I would get mad at myself. And so I found myself, I was scheduling things around. I always at all times have this printout of who I have pregnant and who is delivering each month. And I would schedule things around that time. And even that, of course, women can have baby anytime. Right. But I would try to pick like a week or whatever weekend where they're the least likelihood of someone going into labor. So I definitely was starting to miss out on things just because I didn't want to leave town. My husband will tell you, I would wake up at all hours of the night because I wanted to take care of my own patients. And again, my patients loved it. I mean, they got to see me, right. Where these days, many are seeing a hospitalist or someone else that's not their doctor. I was very hands-on. I've been very hands-on. But it definitely played a factor in my relationships, my family, my spouse. My kids just got to be like, okay, mom's, going to work, we're in a movie. We take 2 cars in case I have to leave. And so that kind of became more of a routine, which is not that great. And it definitely weighed on my mental health when I would leave town, leave town and then still get a call. And I'm like, I did all these things and I'm still missing it. And and that weighed on me. Like, now I let her down and literally it would keep me up at night sometimes. Wow. And so I realized like that's not good. So I started explaining to patients now in the beginning that, hey, I will do everything I can to attend delivery. But if I do have plans coming up, I will tell you, I have plans in July and you're due in July. I'm going to let you know, hey, I have plans this week. So at least you are mentally prepared that, okay, doctor is going to be gone this week. And so then when patients kind of knew that, okay, she has vacation, it at least made me feel a little bit better if I have to miss it, because it definitely was starting to weigh on me a lot. Missing any patient or missing out on a patient.
So was this a transition that you had with your family saying, hey, mom, you're missing a lot? Or was this more of something where you just kind of said, hey, I don't want to be this stressed? What kind of prompted that?
Yeah, it was more self-inflicted, just because, one of my old colleagues, like, he said, I'm going through a divorce and I'm going through a divorce because I work too much. And, because he was doing the same thing. He would be on vacation and he would just turn around and come back. And, and he said, his family got used to him not being there. And so just listening to him and then realizing that I was working my way into that. And that's not what I wanted to be. And that's not being a good role model either to my patients. And it's not living healthily if I'm, on vacation, literally. And I even remember my wedding week, I was gone, and still I could not help myself but to pull up the hospital.
Oh my goodness.
EMR on my phone just to see, like, I just want to see if any of my patients are there. And, I just caught myself doing that so many times, just like, and even several times a day. Or I
Mm,
would just wake up in the middle of the night, like, okay, let me just roll over and see if any of my patient. And I never got like into a deep sleep because I would
mhm.
wanted to constantly be able to be on the go at any moment. And so I remember when I started doing that, and it gave me permission to even just like to sleep fully and not
Mm.
sleep with my phone like right by my head. And so I was like, it's a different feeling when you sleep all night and not wake up randomly just to check your phone to make sure you didn't miss a call from the nurse. So it definitely but it was definitely self-driven to kind of reel things in a little bit. So.
Well, I'm happy that you were reeling those things in, because again, I think so many professions, not just being a physician or doctor, but we give and we give and we give, and if there are no healthy boundaries of, okay, obviously your stuff can literally be life or death, but a lot of times people's profession isn't necessarily life or death, and
Right.
so it's so important that we do establish those boundaries. But speaking of life or death,
Yes.
how do you deal with it if you lose a patient, or like what do you do as your decompression from that? Because
Mhm.
obviously it's apparent you care, right?
Yes.
So the fact that you do care about your patients, you listen to them, you get to know them as people. Losing a patient or something, have you had to deal with that, and if so, how did you handle your own mental health through that process?
Yes. I I had not had to deal with that really until COVID. And then,
Mm,
because mostly, again, since I do deliveries and things, most of my patients are, younger. So I
mhm.
don't have an extremely older population. So I hadn't had to deal with a lot of that until COVID. And with COVID, I had several young, otherwise healthy patients to
Yeah.
pass away. And that was a lot. That was tough. And I think I compartmentalized it. I think that helped to motivate me more to try to get as many people following the guidelines as I
Mhm.
could, because I tried to like think about, okay, what is it that could have led to these people like getting COVID and passing, getting in the ICU, and then the
Right.
whole thing.
Mhm.
Um, and so I really tried to take a more active role in helping to convince the people that, just taking the time to talk to the people that were adamant. And I successfully like got many people vaccinated that at first were like, I'm not doing that. And, just being real with them, like, these things, this is the true reality.
Right.
Of course, I didn't win everybody. I will not say that, but I definitely won over some people that originally were like, I'm not doing that.
Mhm.
But I think that's how I channeled it, and the energy.
Mhm.
I really kind of put more focus and energy into like, okay, how can we prevent any more of these?
Yeah.
So again, luckily I haven't had too much of a loss of patients, but and then I've had, of course, a couple of patients to lose a baby.
Mhm.
I think that was really, really rough, but same thing. I just try to encourage them, like, this happens for a reason, and many, many times we don't know why. But now we know, and if you do make that choice to get pregnant again, then these are things that we can do. And then I just try to, be, again, extra care for them the
Mhm.
next time they go through a pregnancy. So those are probably the two kind of circumstances when I've lost the patient.
So what I hear is you channel your energy into how can I prevent future things.
Yes,
You
right.
it's very
Mhm.
much like, okay, that happened. I'm not gonna necessarily dwell on that, but
Yeah.
I'm going to use all of that I know from that experience to hopefully prevent something in the future.
Yes, absolutely. Mhm.
Okay. So for you, what does self-care look like?
Ooh, self-care, taking time for yourself. Like I said, I have 3 sons, so I'm the only female. I'm the only XX chromosome in this house. So, I try to take just time for me away from the house. whether that's getting my nails done this week or getting my hair done, whatever next week, but just doing something that just brings me joy, makes me happy. So yeah, that's how I try to, it's, my thing is I love shopping and I love, feeling good. And
And you
to me,
always look so great.
and to me, if you look good, you feel good. If I'm like staying in bed and not combing my hair, or even if I'm not going anywhere, I don't. I'm gonna look how I feel. So if I can spruce up and get my nails done every 3 weeks, and even if I'm not going, I don't have any like event or whatever, I can look down and like, no, my nails look good, so I'm gonna feel good. And so that's what I do to try to brighten up, a gloom day.
Okay. So what would you say? I want you to talk to two different groups. The first group I want you to talk to is like patients, like words of, I guess, advice or wisdom for patients who may be struggling with something with their mental health. And then I want you to talk to other doctors or other medical professionals who are, like you said, maybe a little embarrassed or feel some type of way about admitting that there are some issues. What would you say to that group as well?
Yeah, so for patients, I would say, listen, mental health, we try to disconnect our mental and physical health, but they really go together. And it's just as important to take care of your mental health as you would if I told you you have diabetes or cancer and you would take medicines and do treatment for those. It's just as important to do treatment for your mental health. You can't be well in the rest of your life if you aren't taking care of your mental health. And so it's very important. And there are so many different treatments and there's so many things we can do to get it back on track. And the one thing that I try to encourage or to explain to patients is that mental health is pathology. So as you mentioned earlier, doctors sending patients to you thinking they're having a heart attack and it's really anxiety. Mental health will cause you physical symptoms, GI symptoms. Every organ system is affected by your mental health. So all of these little different things that you've been having and not getting the answers to, we have to take a step back and think, once we've ruled out, all these systems are fine, all your labs are good. Let's now look at it and explore, maybe this is a mental health problem.
Okay. And what would you say to your colleagues or other doctors?
Yes. My colleagues, I would tell them, you cannot be an effective doctor if you are struggling yourself with mental health, because patients will see right through you. Or one symptom, of depression is irritability. And so, you're not going to be a great listener, or you're going to be more snappy and different things if you are not taking care of your own mental health. So even if you don't want to admit it, for that sake, you don't want to say you have a problem, just think about, your job and your livelihood, and you're not going to be as good at your job until you take care of your own mental health as well.
Very good. Again, thank you so much. I think these discussions, obviously, I believe are really important for us to have. Any questions that you have for me, or any last comments you'd like to say as we talk about this or as we end our interview?
Yeah, no, I think this is great. Like you said, mental health, just addressing it, that's the first step for people to take note. Like, okay, let me really just tap into this. And like I said, I think everyone needs a counselor. And I just think it's so important. Just talk to your family health, your primary care provider. And it's always better to connect with someone before you're in a crisis. So I think this is a great platform to really like get people to just think about and reflect on their own self. So then, they can bring it up and hopefully then get that referral to talk with someone before things are really, really out of control. So
yeah. I agree 100%. We all need somebody to talk to. I want to just give a shout out to you. I remember I met you when, I think Andre's your oldest, right?
Yes.
Yeah, Andre was playing basketball with my little brother when they were like fourth grade, I think fourth or fifth grade, and just like to see you go like I think you were in college. I don't know if it was undergrad
Mhm.
or what, but just to see you're working as a student, and now I'm interviewing Dr. Trent. That's really like shout out to you for all of the sacrifices. Shout out to you for maintaining your sanity through all of that. Again, it takes a lot of discipline, and it does take a lot of just grit to say I have a goal, I'm going to see that through, but I'm not going to be so stubborn that again I don't take advantage of my support system and I don't utilize the things that I can do. And so you're such an inspiration. I hope you inspired other people that are watching, that the dream is not too late to go for it. Also, again, to take care of yourself along the journey and along that path. So again, thank you so much. I do want to share a couple of announcements before we end. Again, you guys know every Thursday I'm right here at 12 p.m. So make sure you're joining next Thursday for another guest as we talk about minding our mental health. I want to remind you guys on July the 15th, I will be hosting a Learning to Establish Boundaries masterclass, which is only $57. And that is to teach people who are struggling with, saying no, teaching people who are struggling with just implementing those everyday boundaries with family members or at work that they're not able to fully take care of themselves, or maybe they do say no, but they are riddled with guilt after they do that. So that class is really to address that. And we're not just talking boundaries with others, we're talking boundaries for ourselves as well. So I will put the link in the comment section so you guys can register for that. Also, we have the Accountability Circle, which is my group for adults who say, hey, I need somebody to come in. I need a place where I can feel safe, talk through some mental health issues, talk through some different types of things. And so if you know that is you want someone that's going to call you out on some stuff, but also do that in a non-judgmental, caring way, but also motivate and inspire and walk through some different things. That Accountability Circle is only $175 a month, and we have different topics. We get some really good stuff going on in the Accountability Circle. So I encourage y'all to drop that link. And the last thing is, if you have a child, I have the Growth Crew, which is $100 a month. That is really fun. I'm going to be honest. I didn't think I would enjoy it as much. And I am really having a great time with the kids. And we're learning. The last time we talked about goal setting, we were talking about assertiveness, having your boundaries, learning the growth mindset. So we're doing some great stuff with our kids. They're meeting twice a month. Again, that's a small group, and we go over these lessons. They ask questions, they talk. They've kicked all the parents out and said, we don't need you in here. So if you have a child that would be interested in that, go ahead and reach out to me and we can set that up as well. So those are my announcements. Thank you guys. Everybody, again, give Dr. Trent a shout out for taking time to do this, to educate our community, but also for just bringing some really great information, some great knowledge. I know I learned some things. I hope you guys did. Give some hearts, give some fire for her. And again, thank you so much. And we will see you guys next Thursday for Minding My Mental Health right here at 12 o'clock. Bye-bye.